Good day. My name is Kevin Wilk, and I'll be presenting on current concepts in the rehabilitation of ACL injuries. In this presentation, I'll talk about rehabilitation guidelines and programs. The goal of this three-part webinar is to talk about, in part one, which will be today, is developing a rehabilitation program, both preoperatively as well as the early post-operative phase. In the next webinar, we'll talk about the intermediate phases, which will be week 2 to approximately week 12 to 14. And then the third webinar will deal with the advance and return to play phases, dealing with advanced strengthening, sport-specific training, and a return to functional activities. We'll discuss specific rehabilitation protocols utilizing different graphs, and also describe the rehabilitation program with concurrent injuries and surgeries. We hope to provide a scientific rationale and evidence and provide some clinical expertise in the area of these rehabilitation programs. And all these programs will be evidence-based treatments. ACL injuries are common in sports and also strenuous work. Sometimes it's so frequent these injuries occur that the seriousness of the injury is often forgotten. When we talk about ACL injuries in North America, it's estimated that approximately 200,000 ACLs are sustained annually. About 100,000 of these injuries will undergo surgery. The rehabilitation of these problems has changed dramatically in the last 10 to 12 years, and there's a certain science to the rehabilitation. Also, one of the goals is not only just treating the graft itself as it matures, but also returning muscle function, neuromuscular status, but also the knee back to a homeostasis state. As I mentioned, sometimes the seriousness of this injury is underestimated, and we think all these individuals will make it back to sports.